My assumption is that the new variant is here in Connecticut.
First at 5 o'clock, rising concerns over the new COVID variant. Health officials in Connecticut continue to monitor the situation very closely as the new strain spreads across the country. So here's what we know so far. At least 5 states are reporting Omicron cases. New York alone recorded 5. Doctors predict it will become the dominant strain in just a few months. COVID has been spreading here in Connecticut, but it's surging even faster in Massachusetts. Some hospitals there are actually running out of ICU beds. Channel 3 Eyewitness News reporter Mike Savino checked in with Connecticut hospitals to get answers on how they are faring. He joins us live from Hartford Hospital with much more. Hi, Mike.
Hi, Courtney. Some of the hospitals that I talked to say that they are taking transfers from other hospitals in Massachusetts, telling me that they're taking non-COVID patients, but this does free up space for COVID patients at those other hospitals. But does this leave us enough space for our own patients here in Connecticut?
We are seeing a rise in hospitalizations, and in fact, some of those are in the ICU.
As COVID surges in Connecticut, so too are hospitalizations. Officials at Hartford Healthcare say their hospital is caring for 168 patients, up 200% since the end of October. Statewide, a total of 414 people are hospitalized, but this is still far fewer than the 1,200 patients a year ago. So how are Connecticut hospitals helping other states that are facing overcrowding?
We have, from a small standpoint, seen a few patients come from out of state, but we're not openly saying, give us every COVID patient.
We reached out to several healthcare networks. Hartford Healthcare and UConn Health both say yes, they are helping by taking non-COVID patients. But why not take COVID-infected patients too?
With COVID, you've got the infectious risks and concerns.
Doctors also say our hospitals can add capacity like we did early in the pandemic. We can convert rooms into ICU units, and we can bring back field hospitals. But when would hospitals make those decisions?
That rate of increase is going to be really what drives our decision to take that next step to start opening up additional units.
Why not just play it safe and do it now?
Finding respiratory therapists and nurses and doctors to staff these units has been somewhat problematic.
One other reason doctors are optimistic about our hospital capacity, 2 new COVID treatments could be coming up on the way. Coming up on Eyewitness News at 6, I'll tell you about the potential rollout for these new COVID pills. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.
Okay, Mike, thank you.